Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Welcome back to our part 2 of our ongoing series on early morning warm-ups for degenerative disc disease in the lower back. Today we're going to be talking about hip mobility. Hope you enjoy. So today we're going to continue on our subject of warming up the lower back with degenerative disc disease in the morning so you don't hurt yourself. Remember, the low back is filled with extra fluid in the morning from being recumbent. The discs imbibe or draw in fluid. The discs are at the highest pressure early in the morning, and that's the time where we're most likely to have aggravation of our lower back pain when we bend to get dressed, when we bend to get in the shower, or if you're like me, first thing in the morning, bending to work out. So this warm-up series that we have in 3 parts is essential to prime and loosen and make ready or prepare your lower back and your hip joints to be able to move first thing in the morning and throughout the day without hurting yourself. So last time we talked about how to mobilize the small joints and the disc fibers of the low back. Today we're going to be talking about the second part. Once you've done that, you're now going to mobilize the hip joints. Remember, if your hips are tight, if they're not working right in terms of the muscle recruitment, it's going to be a lot more common for you to overutilize your back. If your hip joint can't bend, your back has to bend. That's going to especially put pressure on the discs first thing in the morning when they're at their most dangerous part of the day. So to begin, we're going to use a kick curl. When we do your second phase of this early morning program, remember you're going to engage your RPI, your neutral spine position, to mobilize your hips as well. If you don't know what your neutral spine position is, go to either the Pain Free and Fit or Posture Size websites, take the free body analysis, learn what your neutral spine is. It's going to be different for you. For me, I have to make sure I engage my left multifidus at L5. It's the chronically inhibited one. I know I can't hip hike on the left side. I have to watch out for my left leg turning out. I have to make sure my right internal oblique doesn't overactivate when I engage my transverse abdominis. That's me. What about you? You only know that through an analysis of your own body. If you're not targeting your own unique mechanical corrections, taking care of your own muscle imbalances and stability issues when it comes to your lower back degenerative disc, this or any exercise is going to be more likely to use your old motor patterns, your old movement habits, your old stability habits, and you're going to ingrain those even more to put more pressure on your discs and irritate them. So don't strengthen dysfunction, strengthen proper function. So once I engage my neutral spine, so I have my spine in a safe position, I'm going to use a kick curl. Now a kick curl is a great exercise for the hip first thing in the morning. I'm going to simply raise my knee upwards and kick out as I straighten my knee. This is combining hip flexion, moving forward with a little hamstring stretch. After 2 seconds, I'll move backwards from the hip, making sure I don't overarch the back, maintain my neutral spine, and curl. Bring my heel up toward my buttock. That's stretching the quads, tight rectus femoris, one of my hip flexors, and contracting the hamstring. If I have a tendency to have an anterior hip malposition, which is common for a lot of people with chronic lower back pain, where the hip flexors are more active than the glutes, I need to really emphasize sliding the top of my femur, my thigh bone, backwards in the socket with my glute muscle as I come forward in a hip flexion for that, and not as much as I go backwards. So again, I'm going to go through mobilizations, maybe 6 to 12 in each direction. I'll do that on both legs. I can also use an adduction pattern where I bring my leg across, hold for a few seconds, and then across the other way. Again, if I have a tendency to externally rotate my leg, if that's one of my postural faults or my go-tos in terms of my movement abnormalities, I'm going to emphasize pigeon-toeing the leg and avoiding that turnout as I go out with an adduction. Again, you're not trying to get a big stretch. You're just going to a point of a comfortable range of motion and holding. You can also bring that across the low back or the opposite side of the thigh. You can use kidney beam mobilizations. We've talked about these in a lot of our fast track programs for degenerative disc disease and even spondylolisthesis and other programs. This is where in hip flexion, keeping those same corrections on my body, I'm going to bring the knee across the other thigh a little bit and then wrap it backwards and across the thigh behind me a little bit. So I have a circular pattern, but it includes trying to come across both in the front and the back of my thigh. I can do that clockwise and then counterclockwise. If you have a problem, let's say, with your feet with stabilization, as you're on one leg, you're going to make sure you're not pronating, falling in on the inner edge, maintaining a 4-point balance on the foot. On the leg that's standing, that's not moving during these active mobilizations, you're avoiding hip hiking. You don't, when you're mobilizing your one leg, want to hip hike or let that hip fly up or the rib to crash down on that side. You want to keep that side tall so that you have a good base of support. That's activating the glute medius and the other hip muscles on that side to stabilize you. That's an important wake-up call first thing in the morning. Besides mobility, you're trying to activate these muscles. Likewise, if I'm trying to activate my glute max, which is essential for a lot of people with degenerative disc disease, to get it used to firing first thing in the morning, to neurologically wake it up or activate it, I can use a simple backwards and sideways motion. Hold that for a few seconds. That's activating my glute. Again, if I have a tendency to externally rotate that leg, I'm going to make sure I pigeon toe that a little bit. So I'm using some of my RPI or reverse posture isometric corrections as I'm doing this warm-up. I'm not only getting motion in, I can also bend my knee and move at various angles. Hold for a second or two. External rotation, internal rotation, behind my body. And if I want, I could hold on to something for a little support. Internal rotation, external rotation. The more multiple points or ranges of motion you're giving your hip first thing in the morning, you're opening up that joint. You're stimulating a lot of those hip muscles. So by the time you get done with this the more points that you hit with these mobilizations with your hip, the more you're going to be opening up the hip joint. The more range of motion in the hip, and the more you're going to be activating the various hip muscles, so that when you go to move after your warm-up, when you either go to work out or just start your day, your hips are going to be loose, the muscles are going to be primed, and you're going to be able to move from your major power muscles of your hip and your leg without overtaxing the back. If your hips are stiff first thing in the morning and you try to move, hip doesn't want to move, low back has to move more, we know, especially in flexion, that's much more likely to aggravate that degenerative herniated or bulging disc first thing in the morning. If you like this video on warm-ups and hip mobility, feel free to subscribe to our channel. We've got a lot of great videos out there for degenerative disc disease. Questions or comments, write in. I'll do my best to answer them. And remember, give me a thumbs up. Let's help some more people out there that are suffering with degenerative disc disease and spread these good exercises. If you're looking for a great program to learn how to stabilize your lower back, to learn what your mechanical issues are that are insulting your degenerative discs and causing injury, preventing you from working out and getting into great shape, check out our Fast Track program at the painfreeandfit.com website for degenerative discs. It has all the self-analysis you need in there, all the corrective exercises, stretches, and a step-by-step program of how to build up exercises uniquely for your particular mechanics to get back into fitness, to get back into sports, to get back into being physical without hurting your degenerative discs. And again, if you don't like to read and you don't like to take care of that own program, you can always contact me. You and I can get together video conferencing and figure out a great program that's tailored for you. I hope this series on hip mobility, early morning warm-ups for degenerative disc disease helps you with your chronic lower back issues.